Dr. Ibrahim from City Skin Clinic. Welcome to another one of our videos. Today I am going to be talking about tech neck and the different treatments for it. This is something that we get loads of questions about in clinic all the time, and it's something that's beginning to be even more of an issue as we all spend more and more time looking down at our phone screens or iPads or any other electronic device, and it's an issue that we've got a few different treatments that can help. So as always, I'll let you know the different treatments, including at-home things that you can try, as well as what we can offer in clinic. Before you settle down and watch this video, don't forget to hit the notification icon and subscribe to this channel if you want to see more of the same. So, what is tech neck? I hear some of you ask, whilst a few of you will be like, please tell me more. So tech neck is really just a name given to having kind of vertical bands around, horizontal, not vertical, bands in the neck, and these are really common. They're not something that's dangerous or anything you need to worry about, but for quite a few people it bothers them having these lines, and I often get asked what kind of treatments would work best for them. We also have lots of other different types of treatments for the neck. I will briefly mention them, but really the point of this video is to talk about tech neck. So these vertical lines, horizontal lines, why do I keep saying vertical? These are caused, they're wrinkles like anywhere else in the face. If you bend down a lot, as we often do, over time you'll get these lines, and initially these might be quite fine, and over time they may get more and more deep. And this is important because the earlier you treat them, the less involved the treatment is. So they are wrinkles, and we treat them like any other wrinkle, except just with the knowledge that they're on the neck. One of the treatments that we can do for these lines is Profhilo. So this is really great for two reasons. One, if your neck is just feeling a little bit dry or a little bit crepey, and if you have these lines and they've just started, they're fine, then Profhilo is an injectable hyaluronic acid moisturizer. You usually need a course of 2 or 3 of them initially, to 4 to 6 weeks apart each, to get the maximum results, and they stimulate the collagen and the elastin in the neck. The other treatment that we could recommend is potentially Botox injections in the neck. To be honest, these, we wouldn't do them just for these lines on their own, but if you also have vertical bands, they got it in there, then the non-surgical neck lift will help just give the appearance of a sculpted, tighter neck, and with that will smooth the appearance of these lines. It won't get rid of them completely, but that's something that's kind of a two for. If your issue is both of these, and this is usually someone older perhaps, then often a treatment that involves both the non-surgical neck lift to help with a sagging and vertical bands, and then Profhilo or dermal fillers, which I'll talk about next, to help more with skin quality, and if they're deeper lines, then dermal fillers are best. So then that nicely brings me to the other option that we offer, which is hyaluronic acid dermal fillers. These are great if these lines are quite deep, and so there's a little step between them and the skin, and then filling these lines directly with dermal filler will act as a scaffolding and hold up that wrinkle, because remember, it's still a wrinkle, like any deep wrinkle in the face, that won't go away. So dermal fillers will help with that. The downtime for dermal fillers, when we use them in the neck to fill an area like this, it may leave some redness and some swelling and some bruising immediately after. So it's something, any of the neck procedures are not something to be done if you've got a photo shoot of your neck the next day or in a few days. It's something you just need to allow a bit of time to settle. And so dermal fillers are really great for that. Like I mentioned, sometimes you need to combine these procedures together if you have different problems, but as a general rule, if the lines are very thick and they're already ingrained, dermal fillers are going to be the best option. If they are just starting to appear and the general skin quality is a problem, then Profhilo is going to be great. If you've got these lines and you've got vertical bands and a sagging neck, then likely Botox and either Profhilo or dermal fillers will be combined. Again, like all of our treatments, the best treatment is based on your expectations and also what your neck currently looks like and what the problem is. That's how you always get the best result. It has to be tailored to you. Another treatment that also we can use in the neck is so in someone who has very fine early lines. So Profhilo is great for overall neck quality and these early lines, but if your concern is just these very early lines and everything's fine, then microneedling can be a really good option. And our microneedling, or as we like to call it, collagen induction therapy, often combines a peel to resurface the skin and microneedling that stimulates the collagen production. It works in a similar way to Profhilo, but the overall effect on skin hydration and luminosity, that's a lot more with Profhilo than it is with collagen induction therapy, but this is just something that's worth taking into account. And then of course there are other treatments that are available that we don't offer. So one of these treatments, the most obvious one, is laser therapy. That's good for, again, really deep lines, and it works in a similar way to collagen induction therapy. It creates these micro injuries that stimulate collagen production. Again, there's a lot of downtime with laser, and laser is a great treatment, but you need to go to a qualified practitioner and go to a centre that is specialised in laser treatment to avoid any problems like hyperpigmentation or burns or anything like that. And then something we don't provide, but other people also use PDO threads or you know, other kinds of treatments for this area to tighten the skin. I will leave a link to the treatments for the neck that I mentioned, or a few links just so that you get an idea. And then last but not least, this is independent of whether you have treatments or not, skincare is absolutely vital. So even if these lines bother you but you aren't that keen on getting any treatments, professional treatments, there's a number of skincare options that you can use. A really good idea is to, if you're not allergic of course, is to use glycolic acid toner regularly, and that will help kind of exfoliate the skin. And then using vitamin C serum, that helps with brightening the skin on the neck and also evening out the skin tone, so it reduces the difference between the bands and the neck. And then of course make sure that you're hydrating properly with hyaluronic acid, and like anywhere in your skin, using an SPF to protect that skin. There are also retinol will help over time with fine lines and wrinkles and help improve the quality of the skin. Or if you're suitable and you want something a bit more involved, then a retinoid such as Tretinoin, which needs to be prescribed by a professional. We offer Obagi Tretinoin in our clinic for patients who are suitable for it. That can help with the skin turnover, and it can definitely help with improving these appearances. These are great. Skincare is great whether or not you decide to have professional treatments. If you decide to have professional treatments, skincare will amplify the effect and make it last longer, good skincare. And that's why we always offer all of our patients a free service where we recommend skincare for them. We also, for people who need something more than basic skincare, so we would recommend skincare from different brands, nothing to do with us, that we just, in our experience and our patients' experience, find really good, and they're easy and accessible and easy to get hold of. And also in some cases where people need professional skincare treatments, then we also have the Obagi range that we can prescribe and provide to them straight to their home. I'll leave a link to both our services so you can just have an idea. But ultimately, the right treatment is really dependent on you, what your expectations are, what your time frame is, and how much treatment you would like. So whether you want something that's a little bit non-surgical but a bit more invasive in the form of fillers or wrinkle relaxing treatment or Profhilo, or whether you want to be completely at home. And again, you go down the skincare, both basic or professional. It's always best if everything's tailored to you and your lifestyle. With that, I'm just going to end this tech neck video. I hope it wasn't too long. Don't forget to subscribe and hit the notification button so that you'll be alerted to all our new videos. And please give this video a thumbs up. And if you don't like it, you can carry on moving along. Leave us a comment below about what you think. If you have any questions about tech neck, the different treatments, or anything else you want to see in our videos. And until next time, have a great day.